starting with our next session on osteology, and it will be taken by Dr. Shubroto Mukherjee sir, and he will be starting with the skull base, right sir?
I am Dr. Shubroto Mukherjee, ex-head of the Department Medical College Kolkata, and now working as Professor Department of ENT GIMS, Boj. And some of the students of Boj has come here to attend the session. Some salient points in osteology I am delivering, particularly the base of the skull. Then the individual bone will be discussed by the other faculty member. As a whole, the skull, when you take the outer upper portion, that is the cranium or the calvaria, that cranium, after taking it out, then the base of the skull will be evident. And this is the base of the skull which will be asked in the exam. Some points in the base of the skull will be asked. As a whole, the base of the skull is divided into three cranial fossa. The first one is anterior cranial fossa, the middle one is the posterior middle cranial fossa, and the posterior one is the posterior cranial fossa. And these three cranial fossae are displayed in a stepwise pattern. The anterior cranial fossa is higher level, middle cranial fossa is at a lower level, then the anterior cranial fossa, and the posterior cranial fossa is the lowest level. The first is anterior cranial fossa. Can you see the anterior cranial fossa? And these anterior cranial fossa are anteriorly bounded by the frontal bone, laterally part of the frontal bone and part of the parietal bone, and the floor is formed mainly by the frontal bone and the roof of the ethmoid. Frontal bone and the roof of the ethmoid. And what is the posterior limit of the anterior cranial fossa? What is the posterior limit? The posterior limit of the anterior cranial fossa is the posterior border of the lesser wing of the sphenoid. Lesser wing of the sphenoid. Posterior border is the lesser wing of the sphenoid, and this is the anterior crinoid process. Anterior crinoid process. Then the posterior bound is formed by the anterior margin of the sulcus chiasmaticus. This is the sulcus chiasmaticus. Sulcus chiasmaticus, and this sulcus chiasmaticus, the anterior border is forming the central part of the posterior border of the posterior anterior cranial fossa. Okay. And in the floor, mainly the orbital plate of the frontal bone. This is the orbital plate of the frontal bone, which forms the roof of the orbit, forms the main part of the floor laterally, and more medially it is formed by the roof of the ethmoid. Roof of the ethmoid, and the roof of the ethmoid is divided into two portions. One is the lateral portion, that is known as fovea ethmoidalis. Fovea ethmoidalis, and that fovea ethmoidalis is nothing but the superior surface of the ethmoid, which is contributed by the frontal bone. That is the fovea ethmoidalis. And in medially, the fovea ethmoidalis, more medially, is the cribriform plate of the ethmoid. Cribriform plate of the ethmoid. And some particular features is that in the central part of the cribriform plate of the ethmoid, there is a projection of bone, and that projection of bone is known as the crista galli of the ethmoid. Crista galli of the ethmoid, which gives attachment to the anterior end of the falx cerebri. In the previous days, when frontal craniotomy is done, at the time frontal craniotomy, then the anterior frontal craniotomy, after doing the frontal craniotomy, anterior skull base operation should be done by elevating the falx cerebri from the crista galli. But nowadays, this surgery can be done through the endoscopic approach, through the nose. Then comes the middle cranial fossa. Floor of the middle cranial fossa, anterior bounded is similarly the posterior boundary of the lesser wing of the sphenoid, anterior crinoid process, then the anterior end of the sulcus chiasmaticus. And the posterior boundary of the middle cranial fossa is the superior border of the temporal bone, superior border of the petrous temporal bone, superior border of the petrous temporal bone, and this is the dorsum celli. Dorsum celli in the middle part. Dorsum celli in the middle part. And in these middle cranial fossa, anteriorly there is an opening. You can see there is an opening in between the two roots of the lesser wing of the sphenoid. Lesser wing of the sphenoid, and this opening is the optic foramen. Can you see? Can you see the optic foramen, all of you? And this optic foramen is formed by in between the two roots of the and lesser wing of the sphenoid, two roots of the lesser wing of the sphenoid, and which structure passes through this foramen. Optic foramen, the structure passing through the optic nerve, but only optic nerve is not sufficient. Optic nerve with the covering meninges, and there is the ophthalmic artery. Ophthalmic artery and the central part, sometimes central vein of retina. Central vein of retina. Ophthalmic artery, optic nerve and ophthalmic artery, what is the relationship? The relationship is ophthalmic artery lies inferolateral to the optic nerve. Inferolateral means it is lateral to the optic nerve and inferior. So that this disposition nature has given particularly for which will be beneficial for the surgeon during optic nerve decompression. Optic nerve decompression. We do optic nerve decompression transnasally, where the medial aspect of the optic nerve is decompressed. So the ophthalmic artery will be spared. Means it is more lateral, so it will not be injured. So the relationship easily you can remember, that is the inferolateral. Ophthalmic artery is inferolateral to the optic nerve. Then there is an opening here in the anterior part of the middle cranial fossa. Can you see the opening here? That is the superior orbital fissure. Superior orbital fissure. Superior orbital fissure. Superior orbital fissure. Can you this? Can you? Sorry. Can you see the superior orbital fissure? Here. Here is the superior orbital fissure, and the superior orbital fissure in between the lesser wing of the sphenoid and the greater wing of the sphenoid. In between the lesser wing and the greater wing. And what is the structure passes through this superior orbital fissure? Usually asked in the exam. You know there is annulus of gene, and some structure passes lateral to the annulus of gene, through the annulus of gene, and some structure passes medial to the annulus of gene. Which structure passes lateral to the annulus of gene? Some structures, can you say? Anybody? Firstly, frontal and lacrimal branch of the ophthalmic division of the trigeminal nerve. Frontal and lacrimal nerve. Any other? Trochlear nerve. Trochlear nerve. Fourth. Then superior ophthalmic vein and a meningeal branch coming from the lacrimal artery. Recurrent meningeal branch coming from the lacrimal artery and the lacrimal branch of the middle meningeal artery. Lacrimal branch of the middle meningeal artery or orbital branch of the middle meningeal artery. Middle meningeal artery is lying in the foramen spinosum. From here the branch goes to the orbit, that is the orbital branch or the lacrimal branch of the middle meningeal artery. Then through the annulus of gene. Through the annulus of gene in the middle portion, which structure passes through the annulus of gene? By two divisions of the oculomotor nerve, nasociliary nerve, abducent nerve and inferior ophthalmic vein. Sometimes the inferior ophthalmic vein may go through the area medial to the annulus of gene. This is the disposition of the different structures in the superior orbital fissure, and how it is practically important from ENT point of view. Sometimes the nasopharyngeal angiofibroma goes towards the orbit, causing proptosis through the superior orbital fissure after going intracranially, then going through the superior orbital fissure. Understand? Then in the floor of the middle canal fossa, as a whole, in the middle portion, it is constricted, which is formed by the superior surface of the body of the sphenoid. Superior surface of the body of the sphenoid, there is a area which is bounded in front by the tuberculum sella, posteriorly by the dorsum sella, and it is known as the sella turcica. Sella turcica. And the deepest portion of the sella turcica lies the hypophysis. Then the lateral portion of the middle canal fossa, which is mainly formed by the superior surface of the gator wing of the sphenoid, laterally by the squamous part of the temporal bone, partly by the parietal bone and partly by the frontal bone, and these four junctions of the bone laterally marked as terion. And here lies some foraminas, important foraminas lies. What are the important foramina? First one, in the lateral to the body of the sphenoid, there is opening here. Can you see the opening? That is the foramen rotundum. And in this foramen passes the maxillary division of the trigeminal nerve. After traversing through the foramen rotundum, where it opens, maxillary division of the trigeminal nerve opens on the posterior wall of the pterygopalatine fossa. And this pterygopalatine fossa lies here. Where the posterior wall of the pterygopalatine fossa lies the maxillary division of the trigeminal nerve. Then it traverses upper part of the pterygopalatine fossa, then goes towards the inferior orbital fissure. Through the inferior orbital fissure, it goes through the inferior orbital canal and ultimately comes in the anterior aspect of the maxilla as the infraorbital foramen. Then another foramen, important foramen, posterolateral to the foramen rotundum. Here is another foramen. Can you see? What is this foramen? Foramen ovale. And what structure passes? Usually it is asked in the exam. Foramen ovale, what are the structures? Mandibular division of the trigeminal nerve, accessory meningeal artery, lesser superficial petrosal nerve, and emissary vein. These are the four structures, and usually that is represented by MALE, male. Mandibular division of the trigeminal nerve, then accessory meningeal artery, then lesser superficial petrosal nerve, and emissary vein connecting the cavernous sinus with the pterygoid venous plexus. And another foramen lateral to the foramen ovale. Is the foramen spinosum. Can you see? Foramen spinosum. Which structure passes through the foramen spinosum? Meningeal artery and vein, and there is another nerve. That nerve coming from the mandibular division of the trigeminal nerve, which ascends upwards, that is known as nervus spinosus. Okay, this is the foramen spinosum. And important is that this middle meningeal artery, after gaining entry through the foramen spinosum, gives a branch which goes posteriorly towards the petrous temporal bone, and that is known as the superficial petrosal branch of middle meningeal artery, which supplies the facial nerve. That is, there is a facial hiatus here in the anterior surface of the gator wing of the sphenoid, in the anterior surface and the superior surface, anterior superior surface of the petrous temporal bone, and that branch supplies the geniculate ganglion region of the facial nerve. that is known as superficial petrosal branch of the middle medial artery or facial hiatus. And there is another foramen in front of this foramen, more medial to this foramen is the foramen lacerum region. Foramen lacerum. Foramen lacerum, actually no important structure passes through the foramen lacerum, but usually the foramen lacerum we call as because there is a perforated plate of cartilage. Perforated plate of cartilage in that area, and this perforated plate of cartilage does not transmit any important structure, but some structure passes in the form of lymph vessels or the emissary vein connecting the cavernous sinus with the pterygoid venous plexus and some meningeal branches of the ascending pharyngeal artery. These are the three structure passes through the foramen lacerum, but important structure which lies in relation to the superior aspect of the foramen lacerum is the carotid artery. Is the carotid artery coming from the carotid canal of the petrous temporal bone. And here on the superior aspect of the foramen lacerum, there is an important structure forms, that is the greater superficial petrosal nerve communicates with the deep petrosal nerve, forming the nerve of the pterygoid canal. You can, nerve of the pterygoid canal opening, you cannot be able to see here from the base of the skull, you can see from the sphenoid. Can it be projected? Here you can see a foramen here. Can you see the foramen? Non-articulated sphenoid, you can be able to see the foramen, and that foramen is the foramen for the pterygoid canal, and through it passes the greater nerve of the pterygoid canal, which again opens in the posterior aspect of the pterygopalatine fossa, posterior aspect of the pterygopalatine fossa. But the relationship on the posterior surface of the pterygopalatine fossa, the pterygian nerve or the nerve of the pterygoid canal and that maxillary nerve is lateral to medial. Lateral is the maxillary nerve, medial is the Vidian nerve. Understand? Another two hiatus you will be able to see here. These two hiatus, in these hiatus on the superior aspect, this is the hiatus, is a branch from the facial nerve, that is the greater superficial petrosal nerve, going towards the foramen lacerum, then it communicates with the deep petrosal nerve, forming the nerve of the pterygoid canal or the Vidian nerve that passes through the Vidian canal. And this is the lesser superficial petrosal nerve which passes through the foramen ovale. But sometimes there may be another opening here in between the foramen ovale and the foramen spinosum. There is canaliculus innominatus we call, and in this canaliculus innominatus the facial, that lesser superficial petrosal nerve passes to be কোথায় যায়? Lesser superficial petrosal nerve supplies the secretomotor supply to the parotid gland. Secretomotor supply to the parotid gland.
Sir, just interrupt for a moment. Sir, other two professors, Dr. Bijan Moshak and Dr. Shubhra has arrived and
Right. Okay, thank you.
So you can continue now, sir.
And now what is the time now? How much time will be allowable to me?
Sir, we have 1 hour for this session. So we are just 15 minutes past.
15 minutes past, okay.
So we have still 45 minutes left.
Okay. In these middle cranial fossa, in the posterior border of the lesser in the sphenoid, there is a sinus that is known as sphenoparietal sinus. Sphenoparietal sinus ultimately drains in the cavernous sinus. And the superior border of the petrous temporal bone, superior border of the petrous temporal bone, there is a sinus which is known as superior petrosal sinus. Superior petrosal sinus. And this superior petrosal sinus here communicates with the cavernous sinus medially. Cavernous sinus lies here, communicates with the cavernous sinus medially, and in laterally communicates with the transverse sinus. With the transverse sinus. Here lies the transverse sinus. Here the transverse sinus is the junction here. This is the superior petrosal sinus. More or less, this is the middle cranial fossa related structures. And another important structure which is an eminence lies on the anterosuperior surface of the petrous temporal bone. Anterosuperior surface of the petrous temporal bone, that is known as arcuate eminence. You can see the arcuate eminence here, arcuate eminence, and this arcuate eminence indicates the position of the superior semicircular canal or anterior semicircular canal. And in the practical point, if the diagnosis is superior semicircular canal dehiscence syndrome, in the middle cranial fossa approach, we can repair that superior semicircular canal area in a superior semicircular canal syndrome. Another important point, at the apex of the petrous temporal bone is there is a depression here which is known as the trigeminal ganglion. Trigeminal ganglion, where lies the seminular ganglion of the trigeminal nerve. Seminular ganglion of the trigeminal nerve. And this petrous temporal bone, here the petrous temporal bone, with the posterior crinoid process, there is a ligament which connects the apex of the petrous temporal bone with the sphenoid, that is known as the petrosphenoid ligament or sphenopetrous ligament or Graver's ligament. Graver's ligament. Petrosphenoid or sphenopetrous or Graver's ligament. And in practical importance is that there is a canal just beneath this ligament, and that canal is known as Dorelow's canal. Dorelow's canal, through which passes the abducens nerve. Through which passes the abducens nerve. And you know already about the Grady-Negos syndrome, that will be asked in the exam. Grady-Negos syndrome. Sphenoid and temporal পড়াবো আর ম্যাক্সিলাও পড়াবো
হ্যাঁ ম্যাক্সিলা হচ্ছে বিএম মাসেল স্যার ঠিক আছে
Any question from this anterior canal fossa or the middle canal fossa? Any question? Practical point? Okay. Canaliculus innominatus. Canaliculus innominatus means the foramen spinosum and the foramen ovale. In between the foramen spinosum and the foramen ovale, there may be sometimes a accessory foramen, and that is known as canaliculus innominatus. And if it is present, then the lesser superficial petrosal nerve, instead of going through the foramen ovale, it will pass through that opening. Okay. And similarly, there is an opening also here medial to the foramen ovale, sometimes present, that is known as emissary sphenoidal foramen of Vesalius. Emissary sphenoidal foramen of Vesalius, through which passes a emissary vein connecting the cavernous sinus with the pterygoid venous plexus. But these two, in this particular specimen, these two openings are not present here. It may be present, those are may be present. Then the posterior cranial fossa. Posterior cranial fossa. Posterior cranial fossa, anteriorly bounded by the superior border of the petrous temporal bone, anteriorly bounded by the superior border of the petrous temporal bone, dorsum sella, and here is a sloping surface that is known as clivus. Clivus. That clivus is formed by articulation of the basisphenoid with the basiocciput. Basisphenoid and the basiocciput combinedly known as the clivus. and mainly the border is here, but mainly is formed by the posterior surface of the petrous temporal bone. Posterior surface of the petrous temporal bone. Here, the posterior surface of the petrous bone. Laterally, by the squamous part of the occipital bone, squamous part of the occipital bone, squamous part of the occipital bone here, and you can see the impression here, that is for the transverse sinus, which is going towards the another sinus that is known as sigmoid sinus. Transverse sinus, then sigmoid sinus, and sigmoid sinus being continued inferiorly through the jugular foramen as the interjugular vein. Important structure on the posterior surface of the petrous temporal bone. Here there is an opening. You can see the opening here. Can you see the opening? What is that opening? Internal auditory meatus. Internal auditory meatus, that is the porus. That is not the fundus. Fundus is the lateral end, this is the porus. And through which structures passes, you know, more or less. Two divisions of the facial nerve, foramen singular nerve and vestibulocochlear nerve, and the important artery and vein, that is the labyrinthine artery or the labyrinthine vein. Labyrinthine artery and the labyrinthine vein. Labyrinthine artery is a branch of anterior inferior cerebellar artery. Anterior inferior cerebellar artery, but sometimes it may come from the basilar artery. Basilar artery formed by the union of the two vertebral arteries. And there is another slit here. Can you see the slit here? This is the slit. What is this slit? There, can you see the slit? What is that slit? That is the vestibular aqueduct opening. Vestibular aqueduct opening through which passes the endolymphatic duct to be continued as saccus endolymphaticus. And this is the sigmoid sinus area, and there is a foramen here. Can you see the foramen? Can you see the foramen? That foramen is the mastoid foramen. Mastoid foramen, what is that? Mastoid foramen through which an emissary vein coming from the external aspect to be terminated in the sigmoid sinus. And this vein in practical situation directs the surgeon in a form of minimally invasive retrosigmoid approach to the posterior cranial fossa. MIRA, minimally invasive retrosigmoid approach to the posterior cranial fossa. And there is an important foramen here. Can you see the foramen? What is this foramen? That is the jugular foramen. And this jugular foramen is subdivided into three compartments: anterior compartment, middle and posterior compartment. Through the anterior compartment, the inferior petrosal sinus going towards the superior bulb of the interjugular vein. Inferior petrosal sinus. And then in the middle part, three nerves: glossopharyngeal, vagus and spinal accessory. And these three nerves, the glossopharyngeal lies in a separate sheath, vagus and accessory nerve lies in the separate sheath. And the most posterior compartment through which the sigmoid sinus becomes continuous as the superior bulb of the interjugular vein. And particularly the jugular foramen is important as a spreading tumor of nasopharyngeal carcinoma. And you know that the big foramen in the central part is the foramen magnum. All the structures through the foramen magnum is usually not asked in the exam, but important one you have to say, that is the medulla oblongata, not the spinal cord. Medulla oblongata, which is covering meninges, and the important from our point of view is the vertebral arteries. Vertebral arteries. Vertebral arteries ultimately forms the basilar artery in front of the pons, then in this basilar artery ultimately divides into the posterior cerebral artery, which is a part of the circle of Ulrich. And you will be asked about the circle of Ulrich sometimes. You should say more or less complete with it. Any question from this foramen? And another important point, along the petrous temporal bone, this petrous temporal bone, there may be fracture of the petrous temporal bone, fracture. And in this fracture may be usually longitudinal fracture or transverse fracture. Longitudinal fracture and transverse fracture. Longitudinal fracture is along the long axis of the petrous temporal bone, and transverse fracture is transversely across the petrous temporal bone. And what are the points of difference, clinical presentation difference point between the longitudinal fracture and a transverse fracture? Important is the facial nerve palsy is there. If the facial nerve palsy, which part of the facial nerve will be affected in case of longitudinal fracture? Usually it is the infrageniculate portion, even the tympanic segment of the facial nerve. But in a case of transverse fracture, it is the suprageniculate portion or internal auditory canal portion of the facial nerve will be injured. And usually in a transverse fracture, vertigo will be a presentation, and in a case of longitudinal fracture, deafness will be presentation. Okay.
May I request Dr. Subroto Sengupta, please continue the osteology part, next part, that is sphenoid and the temporal bone. Then we will go for the back sit-up.
So, sir has wonderfully presented the skull base anatomy, and actually I don't have anything else to add. So, it will be a recapitulation of what Professor Mukherjee has already told you. So, you can see this is the temporal bone. So, temporal bone in a very short, what are the key things that can be asked in the exam? So, we must know that what are the parts of the temporal bone. This is the squamous part. This is the petromastoid. Petrous part along with the mastoid part. Here lies the tympanic plate, tympanic bone. This is the zygoma. Okay. Okay. So, in the squamous part of the temporal bone, this is the external surface, outside. Important thing here is you can see this line. This is groove for middle temporal artery. And what is the attachment here? Which muscle? Temporalis muscle. And this area is of giving which area of head and neck? Temporalis, temporal fossa. Below is the infratemporal fossa. This is root of zygoma. This has two roots, one anterior, one posterior. Here you can see this is the temporomandibular joint. Okay. The temporomandibular joint has two parts. One is the articular part. This is the non-articular part. The articular part, here lies the TM joint, disc, cartilage. The non-articular part is formed by which bone? This bone? Tympanic plate. It has two sutures. What is this? Can you identify this? What should I say, suture or fissure? This is a fissure. Name it. Name it. What is the name? Petrotympanic fissure. Okay. Temporal bone, petrous bone. Fusion is the petrotympanic fissure. So what we need to know about it? What is the structure that passes through it? Chorda tympani. Very good. So where were we? Yeah. So this is the petrotympanic suture, chorda tympani, and another structure, if you can remember. Anterior ligament of malleus, which comes from the spine of sphenoid. Where is the spine of sphenoid? What is this opening? Short term memory retention at least is for at least 1 day, 24 hours. Na? So, foramen, what part of foramen? This one? Foramen lacerum. This one? Spinosum. Just behind the spinosum is the spine of sphenoid, small structure. And here you can see the petrotympanic fissure. This anterior ligament of malleus is attached to the spine of sphenoid and enters the middle ear through the petrotympanic fissure. Okay. Now, so this is the TM joint fossa, non-articular part, tympanic plate. This one, styloid process. Muscles attached, 3 muscles with their nerve supply. Styloglossus to the tongue, hypoglossal. Stylopharyngeus, glossopharyngeal, and stylohyoid, facial. Behind the styloid process, stylomastoid foramen. Okay? So facial nerve comes out of it. After coming out, it goes lateral or medial to the styloid process? Medially. So during parotid surgery, you expose the styloid process. So it's lateral to the styloid process. And from the styloid process, only these muscular attachment, nerve supply, and the relationship with the facial nerve, that is important. Just behind the styloid process. Okay, we will come to it later. So we have covered the external surface of the squamous temporal, the zygoma. Now tell me what this is the zygomatic process. It articulates with temporal process of zygoma to form the arch of zygomatic arch. So this portion, so this is the temporal bone in anatomical position. Here it articulates with what? Parietal. Here what? Greater wing of sphenoid. And here occiput. So here is the meeting point of 3 bones, temporal, parietal, and greater wing of sphenoid. That area is known as pteria. Okay. Externally, again, this is the mastoid part of the petromastoid portion of the temporal bone. This is the mastoid process. Name 2 muscles which are attached here. Sternocleidomastoid and digastric not attached here. What is this? Digastric ridge, posterior belly of digastric. What is this? Sir covered it in the last. Mastoid foramen. Sir already told what is the structure that passes through it. Emissary vein, which identifies clinical surgical importance is for rectosigmoid approach. Okay. So now let's move on to this surface. This is the cerebral surface of squamous. Here you can see these grooves, these are for the cerebrum. You can see this impression. Can you see? Can you see this impression? What artery? Very important artery. Middle meningeal. Middle meningeal comes from where? Third part of maxillary. Enters the skull through foramen spinosum. So where is the foramen spinosum? Here, foramen spinosum. It comes and you see it along the temporal bone then. Foramen spinosum is in the sphenoid. It comes through the foramen spinosum and goes along the cerebral surface of squamous part. Now, this is a fissure, this is a, I should say, junction, okay, suture. Can you name the suture? This squamous part, this is the petrosquamous suture. From the petrosquamous suture, if we go anterior to posterior, again sir has told everything. This area is trigeminal impression. As we go beyond, there is an elevation, arcuate eminence. As we go further beyond, roof-like structure of something. It forms the roof of what? Tegment tympani. Below it is the middle ear. Here is the superior semicircular canal. Okay? Okay. Now, anterior, the medial portion. Very easy. Internal acoustic meatus. Let's revise what is the arrangement of the nerves and other things that passes through the internal acoustic meatus. So, it is divided by a horizontal septum into two upper and lower division. Upper division is divided by a vertical section. What is the name? So, anterior to Billsbury is facial, posterior superior vestibular nerve. Anterior below in the lower quadrant, anteriorly there will be multiple fenestrations like a cribriform type appearance. What is that? Cochlear nerve fibers, and behind inferior vestibular nerve. Sometimes there may be another thing may be passing, singular nerve for posterior. This is vestibular aqueduct. Okay. Acha. The most important thing here is to identify in the lower part, that is the, what is this? Carotid canal, internal carotid artery through the lower part of the inferior surface of the petrous temporal bone coming out here. What is the course of internal carotid artery, that will be asked, and it comes out through here and it reaches the sphenoid, carotid sulcus. This is the carotid sulcus and it goes through this portion. We will come to it later. So, more or less this is about important structures of the temporal bone. I am not going into McEwen's triangle, everybody knows, undergraduate, where do you drill cortical mastectomy, what are the surface markings, what is the extent of your drilling, all these things I am not going to discuss. Okay. Since we are having a time crunch, so let us move on to sphenoid. The sphenoid again has three parts, okay, four parts actually. Body of sphenoid, greater wing, lesser wing, the pterygoids are broken. And the pterygoid plates, four parts. Okay. So, if we start from here, this is the neurology, neurosurgical view. we are not interested, but we don't have to deal with it. So, here lies the superior surface of the body of sphenoid. Here lies the jugum sphenoidal, which houses, what does it lodge? Here, olfactory tract. Okay. This area, sulcus chiasmaticus. Here we can see two openings through which the optic nerve comes and the optic chiasma is here. Beyond this is the tuberculum celli, and this depression is sella turcica, which houses the pituitary. Here it is slightly broken. This should be dorsum celli. These are two of the lesser wing. These are two anterior clinoid process. Here is the middle clinoid process, and here will be the posterior clinoid process. Okay, and this is the dorsal celli, which is continued as the clivus. Here you can see the posterior clinoid process. Why I am saying this? Now, from here the optic nerve enters. Here lies the chiasma. As I have said, the internal carotid artery comes through here, goes on either side of the chiasma and enters medial to the anterior clinoid process on either side of the chiasma. And it gives rise to 5 terminal branches. And foramens already discussed, nothing more to discuss. Only thing is superior orbital fissure, inferior orbital fissure. Okay. How does the foramen rotundum? Here is the foramen rotundum. It goes where? To the pterygopalatine fossa. Passes, what structure passes through it? Maxillary nerve. It goes on to the base of the roof of the maxillary sinus, infraorbital nerve. So, through the superior orbital fissure there is a tendinous ring, and there are 3 apertures: lateral, medial and the innermost. So, lateral, what are the things?
Just 15 minutes.
What? 15 minutes left. I have another 3 minutes left. But to finish up the whole program. ঠিক আছে স্যার কতক্ষণ লাগবে? আমার আর 5 মিনিট লাগবে। Just remember, superior orbital fissure through the lateral structure. What are the structures that goes through? Ophthalmic division and trochlear. Through the middle portion, through the tendinous ring, abducent and oculomotor and nasociliary. What is the mnemonic? NOA, LFT NOA. L for lacrimal, frontal, trochlear, nasociliary, oculomotor, abducent and inferior ophthalmic vein. Okay. So, we do not have much time. Do you have any questions? Pterygoid plates, there are one thing you must remember, there is a nerve to the pterygoid canal that can be asked. This is the, can you see? This is the pterygoid canal. What passes through it? What is this structure? Is it visible? This is foramen rotundum. And what is this structure? Pterygoid canal. What passes through it? Nerve and artery to pterygoid canal. Okay. And pterygoid plates, you have to remember the muscular attachments. The lateral pterygoid plate gives rise to both the medial and lateral pterygoid muscles. The lateral surface gives to lateral pterygoid, medial surface gives to medial pterygoid. And the medial pterygoid plate, which muscle? Tensor veli palatine. Okay. The pterygoid, the medial pterygoid place, at the end there is an hamulus. From the hamulus, what arises? Sphenomandibular raphe, but pterygomandibular raphe. And what glides over it? The tensor veli palatine. There are lots of things can be asked from osteology. So many foramen, so many sulcus. One thing is sulcus tubi. Where is the sulcus tubi? Can you identify? In the base of skull. This is foramen lacerum. So where can be the sulcus tubi? What is it? Which houses the bony part of the eustachian tube? In close relation with where the petrous temporal bone is joins with the articulates with the greater wing of sphenoid. Okay. If there are any questions, you can ask, otherwise we can proceed to the next speaker with maxilla. And osteology, there can be a separate table, or 2 or 3 bones can be given in the OSCE. Even sphenoid is a very common bone which is given picture and arrows are given to identify the structures for OSCE. Okay? Okay, thank you. Sir?
Now, Professor Bijan Vasak will continue with the maxilla osteology of the maxilla.
এই শোনো আমার পিসমেকার আছে এখানে দেখো না একদম না এদিকটা করে তবে এদিকটা বুঝলাম ও হ্যাঁ 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 ফোনটা নিয়ে নিচ্ছি দাঁড়ো হ্যাঁ আমি নিচ্ছি আমার ওর জন্যে না এটা নিয়ে না এটা থাক Good afternoon everyone. Now I continue with তুই সামনে থাকবে হয়ে যাবে maxilla. This is the pneumatic bone and it has 4 surfaces and 4 processes. The anterior or anterolateral, posterior, medial surface and superior or orbital surface. 4 processes: frontal process, zygomatic process, alveolar process and palatine process. The frontal process, zygomatic process on the lateral side, so it is of the left side of the maxilla. Now on the anterior surface there is a ridge, is a canine eminence. Anterior to it, this is a incisive fossa, give origin to the depressor septae, and posterior above there is a canine fossa, and here you see a whole canal. What is this? Infraorbital foramen, which leads behind the infraorbital groove. This is the posterior surface. Posterior surface is from the anterior boundary of the infratemporal fossa, and posteriorly inferiorly there is a tuberosity. There got maxillary tuberosity, which gives origin to the superficial head of the medial pterygoid muscle. Now superior surface, smooth. This is the anterior border which forms the inferior orbital ring. This is the posterior border which forms the anterior boundary of the inferior orbital fissure. Okay, and in the center there is a canal. It is called infraorbital canal. It was just passing. Okay. Now come to the medial surface. Medial surface, there is an opening. This is a maxillary hiatus. In articulated blood, it is narrow, and the defined processes obliterate this hiatus. Anteriorly, descending process of the lacrimal bone. Anterior-inferiorly, ancillary process of the ethmoid. Posteriorly, perpendicular plate of palatine bone. Inferiorly, maxillary process of the inferior terminal. These are
nasal notch and this is the spine. Posteriorly galo, the processes, the frontal process, there is a crest, it is an anterior-lacrimal crest, which gives attachment to the lacrimal fossa and medial palpebral ligament. This is the alveolar process with where the teeth are attached. Now come the palatal process. With the other palatal process is from the floor of the nose. Here there is a crest. Here posteriorly the medial terminal attached, anteriorly it is called agar, and this is the atrium of the middle meatus. মাসের আমি বলবো না বড় দরকার নেই একো একো এটা শুধু বেশি সময় নষ্ট করে লাভ নেই দেয় না
Thank you, sir.
থ্যাংক ইউ
পাঁচ মিনিটের মধ্যে ছেড়ে দেবো 5 মিনিটের মধ্যে হ্যালো particularly I will say about the internal carotid artery. You have to know the different parts of the internal carotid artery, like the nasopharyngeal part, petrous temporal bone part, then the cavernous part, then the intercerebral part, and the branches of the carotid arteries you should go through. An important point in the maxilla with the nasal bone articulation, you have to know the different osteotomy in rhinoplasty. Different like medial osteotomy, lateral osteotomy, intermediate osteotomy, transverse osteotomy, etc. These 2 points I am in addition. Another point of just for showing purpose, I have taken 2 bones for your inspection in the form of ethmoid and the palatine bone. Palatine bone, how it looks like. This is the ethmoid bone. Can you see the ethmoid bone? This is the crista galli of the ethmoid, labyrinth of the ethmoid, and the labyrinth lateral surface is formed by the orbital surface of the ethmoid bone, labyrinth of the ethmoid. And there is the perpendicular plate of the this is the perpendicular plate of the ethmoid. And another bone, that is the vomer. Can you see the vomer? This is the vomer. Posterior part of the septum is formed by that vomer. And this is the palatine bone. You can see this is the palatine bone. This is the orbital process of the palatine bone, the sphenoidal process of the palatine bone. In between the 2 process there is a notch, that is the sphenopalatine notch, and the process I am holding, that is the pyramidal process of the palatine bone, and this horizontal part, this is the horizontal part of the palatine bone, articulating with the horizontal part of the other side, forming the posterior part of the hard palate. Okay, just for inspection I have taken these 2 bones for you. Okay, that is the, thank you.
Thank you, sir. Thank you, sir.